Hi, good evening. Kartavya Health Diwan welcomes you all to this webinar on understanding PCOS from symptoms to solutions. This session will be presented by Dietitian Aditi Goyal, who is a young and enthusiastic nutritionist and researcher with focus on women health and metabolic health. Aditi is a researcher in nutrition field and has 8 published articles in peer-reviewed journals. She is currently an active member on an internationally funded clinical research trial. She is also a visiting faculty with her alma mater SNDT Women's University, and she is also a founder of her venture TSP Of Health. So let us, without much ado, start on with our webinar from symptoms to solutions, because by Aditi Goyal. Over to you, Aditi.
Hi, good evening to all the viewers, and thank you very much to Kartavya for this opportunity for me to speak about PCOS on this platform. I'll directly start with my slides. Yeah. Can we have the next slide, please? So immediately going into it, since the introduction has already been done, we'll start by understanding a little bit about exactly what is PCOS. PCOS stands for Polycystic Ovarian Syndrome, which is a hormonal disorder characterized by enlarged ovaries with small cysts and excess secretion of androgens in women. So androgens are actually male sex hormones like testosterone, which give males all their characteristics, facial hair, the voice, all those characteristics are obtained by androgens. So these androgens are usually present in very low amounts in women. So when the levels of these androgens rise very, very high, along with other factors, that is what culminates into PCOS in women. Next, please. So clearly visible in this diagram is a comparative of what the doctor will look for when you go to a gynecologist who wants to understand whether or not a woman has PCOS. In a normal ovary, which is seen on the left side, each egg will develop, and in a cyclic process, each ovary will mature one egg alternating month. So 1 month left, then 1 month right, that way. And however, in the PCOS ovaries, as you can see in the picture on the right, all the follicles which contain the egg have become they are stuck in the middle of the maturity cycle, and they kind of align themselves towards the corners of the ovary. So seeing the follicles like that on the corners, that is one of the telltale signs of PCOS. Next, please. So how do you know if you have PCOS? There are multiple internationally confirmed methods in which PCOS is diagnosed by the gynecologist. The Rotterdam criteria is the most commonly used one. So there are 3 things which are important in PCOS. If a woman has at least 2 of them, then the doctor can tell you that yes, you have PCOS. The first, which is what everybody suspects that they have PCOS when this happens, is oligo or anovulation, which means it will come to you in the form of irregular periods or not having any menstrual cycle. So if a woman misses her periods for 2-3 months or doesn't have periods for an extended amount of time, then you would obviously go to a gynecologist, and PCOS is one of the risks that are there if the periods are not regular. The second thing is hyperandrogenism. That means that androgen levels in the woman's body have risen above the normal levels. So women will have developed certain characteristics that are usually more common in men. The most common sign is hirsutism, which is the ability to develop excess facial hair. So if women start seeing very thick hair around the chin, around the jawline, if you start seeing a lot of thick hair on the upper lips, those are signs of hirsutism. There will also sometimes be alopecia, which is hair loss. You will start seeing much more hair loss that happens because of the disbalance in hormones. And the third thing is the polycystic ovaries. So this is something that will be checked through a sonography. If the follicle size is higher than normal, or if the ovarian volume is higher than normal in at least one ovary, that is known as the polycystic ovary, which is where the disorder receives its name from. So if any two of these three are present, then that person can be said to have polycystic ovarian syndrome. The reason why it is called a syndrome is because there are a lot of things that are happening in this syndrome, and any of them could be responsible for your diagnosis. So it's a collection of symptoms that a person experiences. Not necessary that every person will have irregularity of periods or they will have all this facial hair development. So that leads us to different kinds of ways in which PCOS presents itself. Next slide, please. So this is a diagrammatic representation of what happens in the three characteristic features of PCOS. Like you can see in the diagram of this girl, there is a lot of hair and almost a full beard developing, which is what is called as hirsutism. The diagram which I had previously shown, this is a real life sonography picture where you can see that the follicles have lined up right around the outer edge of the ovary. And the anovulation, it means that the egg is not maturing. It is supposed to go through a full cycle within the ovary, mature completely, come out of the ovary and enter into the female reproductive system. But that is not happening, and that is why periods will not happen. Next slide, please. So these are the phenotypes of PCOS. Basically, phenotypes, it means how the disease shows up in a person. Each person is different, and so each person's symptomology will also be different. So there are 4 types of PCOS. Type A PCOS is who will have all 3 major characteristics. They may show some signs of hirsutism, they will not have regular periods, and their sonography will show that they have polycysts. However, type B, their sonography will be normal. Everything will be fine there. However, they will have irregularity of periods and they will have alopecia and all those characteristics of androgenism. Type C will still get regular periods. So if the periods are regular, sometimes nobody would suspect that there is any risk of PCOS. But within the body, in the blood, there will be a lot of androgens and the ovaries will have cysts. In type D, there will be irregularity of periods and there will be cysts in the ovary. However, these women will not experience the physical features will not change. They will not experience any aesthetic differences because the androgen levels are somewhat in control. Next slide, please. So really, it's important to raise awareness about PCOS, which is why this seminar is a wonderful opportunity to speak about it. PCOS is becoming more and more common in women of the reproductive age group. At least 4 to 20% of women between the age groups of 15 and 49 across the world suffer from PCOS. And the cure for PCOS, while somewhat easy to come, is not always accessible to everyone. Next, please. So who can get PCOS? Who would need to worry about their risk of developing this disorder? The first factor is genetics. If there is a genetic predisposition for high androgen levels and for that person to have hormonal irregularities, that person may be at an increased risk of developing PCOS. This is one of the unchangeable factors. What is in the genetic makeup is in the genetic makeup, and we cannot control that. However, everything else is within our control, that we can avoid all these other risk factors. The second one being obesity. The more the person gains weight, the more the person will develop an accumulation of fat. And all the sex hormones in the body, whether male or female, are estrogen, progesterone, testosterone. All these hormones are prepared from cholesterol. So the more fat mass there is, the more availability there will be for a hormone imbalance in the body. So if a person has a sitting job which keeps them at their desk all day long, a person who doesn't have the opportunity to do any physical activity because there's no time, or a person who has no access to physical space where they can become active, if there is no park, if there is no open spaces where they can go out and do some activity, move their body a little bit, all those people will be at the risk of developing obesity, and all those people will also be at the risk of developing PCOS. This is also becoming more and more common because many people have sedentary type jobs where you have to sit in front of a computer for 8-10 hours, and then you go home and you're so tired you just go to sleep. And on the other hand, food which is high in fat and food which you should not be consuming on a daily basis is becoming more and more easily accessible, because you can sit at home and order this food, it will come to your door and you can just eat it. So all those things are causing a rise in obesity. The next factor is stress. Again, stress is, many times we can control, many times you cannot control. People who have highly stressful jobs, or people who have certain issues in their home, even something as small as a long travel to work. Somebody who has to travel 1.5 hours to reach their place of work will also be experiencing a lot of stress. So that stress can factor into the risk of developing PCOS. The next is insulin resistance. So I'll be speaking more in detail about insulin resistance, but insulin is the hormone in the body, which is basically responsible for allowing the usage of glucose in the body. Whatever we use is going to get digested and it's going to convert into glucose in the end. This glucose needs to enter into the cells so that the cells can utilize glucose for energy. And for that process to happen, insulin is required. It's like the cells have a door and insulin is the key. So insulin will help the glucose enter into the cells where they can be used. What happens in insulin resistance is that the insulin no longer works. So while you eat XYZ number of things, you have a lot of glucose in the blood, but the cells are not able to utilize any of that. And that is what is insulin resistance. So there is insulin, but it cannot be used by the body. So insulin resistance will also be a major factor for the development of PCOS. And lastly, inflammation. Internal inflammation can be a factor not just for PCOS, but for a lot of other diseases as well. Inflammation can happen for any number of reasons. Exposure to pollutants, smoking, even passive smoking. If there is somebody in your family who smokes, the inhalation of that smoke can factor into inflammation. The consumption of lot of fatty foods, the consumption of lot of fried foods, all these things can be a factor for inflammation. Not consuming enough amount of fruits and vegetables can also factor into inflammation, and that inflammation can also lead to the development of PCOS. Next, please. So this is a flow of all the factors and how they can lead to PCOS. There are toxins in the environment. Like I said, all the pollution that is around us, especially air pollution, when we go out and we have all this smoke, the fog and everything, which is the vehicular emissions and all, which is not at all good for the body. All those environmental factors, a genetic predisposition, diet and lifestyle, gut dysbiosis, it means that there are not enough good bacteria in the gut. All those things together can lead to the imbalance of hormones, increased amount of testosterone, and insulin resistance in the body, which culminates into PCOS. And PCOS will present in different ways. Clinical features is what you can clearly see. Commonly, women will experience a lot of acne. And like I said, there is a lot of facial hair development. Reproductive features, you will not have regular menstrual cycle happening. you may see issues in fertility. And the metabolic features is an increased risk of metabolic disorders. A woman who has PCOS would be at a greater risk for the development of other metabolic disorders like diabetes, thyroid, CVD, hypertension, heart problems. Everything else can happen to this person. Next, please. So PCOS and insulin, this is a very common risk factor in the development of PCOS. Insulin, if their body has become resistant to insulin, the utilization of glucose will not happen. So there's a lot of extra glucose that is still in the blood, which has not gone into the cells. This glucose will signal to the brain that there is not enough insulin and more insulin needs to be released. So insulin resistance will lead to higher insulin levels within the blood. This is a state which is medically, we call it as hyperinsulinemia, where the levels of insulin in the blood are very, very high. What this extra insulin will do is that it interacts with one of the female sex hormones known as LH, that is luteinizing hormone. This LH is a part of the maturation process of the egg. So when insulin interacts with LH, it also acts as a gonadotropin within the ovarian cells. Gonadotropin, it means something which is related to the reproductive organs and a hormone related to the reproductive organs. What this combination of insulin and LH will do is that it activates the synthesis of androgens in the ovary. This is inappropriate in women because women need androgens. Women have estrogen and progesterone, which are released by the ovaries, and women have LH and another hormone called as FSH, which is released by the brain. These are the female sex hormones that a woman needs. Androgen levels in women are very, very low, and they need to remain low for a woman to have proper maturation of the egg. So when androgen levels are increased, then the signs will be visible. You get your hair and all those things. Because of the high levels of insulin inside the ovary, it prevents the development of the follicles. This is what we saw in one of the initial slides, that the maturation of the egg doesn't completely happen. It doesn't finish the process of maturation. So the insulin will go and disturb the maturation process of the follicles, and that's what causes the cyst formations in the ovary. Insulin also reduces the production of another hormone or another protein known as hepatic sex hormone binding globulin. This globulin would have otherwise bound with the androgens and help to remove them from the body. So what this protein does is it will bind with the androgens and remove them from the body so that levels are maintained at normal. But insulin will disturb this process. So in so many different mechanisms, insulin interferes with the female reproductive system and plays a major part in the development of PCOS. Next, please. So while insulin resistance is not the only factor for PCOS, it is a major factor because it's very common for people to have insulin resistance in the world, and also especially from an Indian point of view, because our bodies are genetically more prone to weight gain, and those risks are higher in Indians. So we can develop insulin resistance also much more easily. The relationship between insulin resistance and PCOD has been confirmed in multiple scientific research studies, where they have shown that if you improve insulin usage in the body, the symptoms of PCOS can reduce, because insulin mediates cell growth and the production of sexual hormones inside the body. In PCOS, the insulin resistance makes it such that only one function of insulin is going to happen. It has two functions. It can affect the hormones and it can affect glucose usage. When there is resistance, the usage of glucose is not happening. But there is so much insulin present in the blood. All that insulin will then be utilized for the hormone production process. And so in the end, the androgens will be much higher than they would have been. And that is how insulin resistance contributes to the development of PCOS. Next slide, please. Again, so this is a diagram that I have taken from one of the research studies, and you can clearly see all the things that happen once the body develops a resistance to insulin. There will be changes in metabolism and cholesterol. That means when you get a blood test done, you will see high levels of cholesterol, you will see high levels of LDL cholesterol and triglycerides and all that. In the liver, it is reducing the production of the sex hormone binding globulin, which causes increased levels of testosterone in the blood. There is a lot of hyperglycemia, which means high sugar levels in the blood, because insulin is not able to work the way it should normally have worked. And on the brain level, it increases the release again of testosterone and androgens from the ovary, as well as it increases adrenal release of androgens, which can be the factor in development of PCOS. At the home level, if a person wants to check whether they may be at the risk of insulin resistance, before even going to a doctor, there's a simple thing that you can do. If you look in the mirror and if you see around your neck over here, there are certain signs. So if a person develops a lot of darkness around the neck area, around the chin, around the lips, all those areas, if you see that there's a lot of pigmentation and darkening happening over there, that is a condition known as acanthosis nigricans, which is a sign of insulin resistance. So if you see a lot of darkness around here, that is a sign to get yourself checked with a blood test to see what your levels of sugar are, to see what your insulin levels are, and to see whether there is hyperinsulinemia happening in the body. Next, please. So insulin resistance is also closely related to obesity. If somebody has insulin resistance, they will develop obesity. And if somebody has obesity, they will have insulin resistance. So the exact mechanism of development of PCOS is not very well understood. Like I said, insulin resistance is not the one and only factor in the development of PCOS. But there have been a lot of studies which have very clearly shown that once weight is lost, then there is a lot of improvements that can be visible. Weight gain makes insulin resistance worse, and it can cause hormonal imbalances of its own. So once a person is overweight, if they even lose a little bit of weight, they will immediately see the changes in terms of they will start getting their regular periods, and they may see other changes as well. So while clearly how obesity and PCOS are connected is not understood, it is definitely true that a person has to lose fat to be able to improve the signs of their PCOS. There is also a type which is commonly we call lean PCOS. Basically, if you look at this person, you will not think that they are fat. They look very slim and trim. They look like they're in shape. But in actuality, they will have a lot of accumulation of fat in their body. And that fat is the one thing which is factoring into them having PCOS. You will look at that person and think, ye to koi mote bhi nahi hai, how they have PCOS. But it doesn't work like that. So to check these things, there is something called as body composition. You can get your body composition checked to see the level of body fat that you have. For women in the reproductive age group, that is between 15 and 49, For this age group, the recommended level of body fat percentage will be between 18 and 28%. So if the body fat percentage is more than 28, it's more than 30, 35, then that is a sign of what we call as adiposity, which means your body has held on to a lot of fat. There's a lot of fat accumulation. On the weighing scale, that person may be thin, but actually they are not healthy from inside. So they need to be able to lose fat to see all the improvements in their symptomology for PCOS. Next, please. So this is how obesity can factor in for PCOS. Obesity does make it more difficult for insulin to do what it has to do. So there is insulin resistance because of obesity. At the same time, all the fat tissue which accumulates within the body of an obese person, there will be a lot of release of a substance called as adipokines, and adipokines increase inflammation. So again, the inflammation will also factor in for PCOS. Again, obesity can also cause a condition known as obstructive sleep apnea. In obstructive sleep apnea, there is not enough oxygen and breathing capacity in a person when they are sleeping. The person cannot breathe properly at night. And because of that, also there will be inflammation and insulin resistance in the person. So all that will cause the metabolic distress in that body and can factor in to PCOS. Next, please. So some of the common symptoms that a person will see in PCOS, like I said, there is development of acne and a lot of facial hair, which is because of high androgen levels. And it will also be very thick hair and quite clearly noticeable in the woman's face. There is a delay in the periods. Either the periods will come but not on time, or they will not come at all for multiple months at a stretch. 3 months, 4 months, 5 months. The periods can get delayed for a very, very long time also. Next, please. The next symptom is fatigue. Insulin resistance as well as the hormonal imbalance that is common in PCOS can cause a lot of physical exhaustion. It will just leave the person feeling so tired and drained all the time because the energy source for the body is glucose, and the glucose is not available to the cells because of insulin resistance. So in the end, the person ends up feeling very, very fatigued. There's no energy to do the work. There's no intention to do the work because you feel lethargic and tired all the time. Like I said already, there will be a certain amount of hair loss sometimes because of high androgen levels. Infertility is a common issue with people who have very severe PCOS because if the egg is not maturing and entering into the uterus, there is no chance of conception and reproduction. So many times people with PCOS will struggle to have a baby. And that infertility is one of the reasons why discussion about PCOS is such a taboo, especially in our country. You won't commonly see a woman coming out to declare that they have PCOS. Next, please. Weight gain. Again, because of all the hormonal imbalance and the fatigue accompanied by the insulin resistance, the women with PCOS will see a lot of gain in weight many times. There is a decrease in the libido. The sex drive is also controlled by all the hormones inside the body. So when there is a lot of high level of androgens in the body, the woman will experience a low sex drive. And all these factors, the weight gain, the hair loss, the hair on the face, all those things factor into a lot of mental problems for a woman with PCOS, and she will face, they can face depression. Many times women with PCOS struggle with a lot of self-esteem and body issues. There's a lot of taboo around the discussions for PCOS, as well as because of the weight gain, they might experience certain level of bullying, whether it's at the home level or the public level, because people have the tendency to call names. People have the tendency to fat shame a person without realizing why they are struggling to lose the weight. But all those aesthetic appearance changes that a woman experiences when PCOS is there, the development of facial hair and all those things, make a woman very insecure about her appearance, and that can lead to a lot of mental health problems. It can lead to depression. And in a state of depression, people usually turn towards foods which are usually higher in fat, foods which are high in salt, foods which are high in sugar. And so all that mental health disturbances will also prevent the woman to gain control of her life by reducing a little bit of weight and managing her PCOS in a more effective. Next, please. So after understanding everything that happens inside the body for a person with PCOS, we come now to the solution part. There is no reason to believe that a woman with PCOS has to be stuck in a heavy body, not get periods on time, and all those things. Women with PCOS can make their periods regular. They can have babies. They can reduce a lot of weight, and all those things can happen. There are a lot of medical treatments also available to help with PCOS. The one most common medicine that is given to a woman with PCOS is metformin. Metformin helps to make the body sensitive to insulin and reduces insulin resistance. So it acts by reducing insulin resistance to help the PCOS woman. And the second is oral contraceptive pills. Oral contraceptive pills have hormones which help to manage the hormone balance in the body. They help to reduce the androgen levels in the body. And so they function in that way. So if a PCOS woman goes to the doctor, there's a high chance that one of these two or a combination of both medicines will be prescribed to this person to help manage PCOS. At the personal level, dietary solutions can be your go-to if you want to get your PCOS in control. It is possible to lose enough weight to get the regular periods and everything to help you manage your PCOS. The person with PCOS has to focus on a low-fat diet because there's an accumulation of fat already in the body, which we want to lose. So that has to happen. If you reduce the fat in the food, then you can reduce the fat in the body. The next thing is that there should be a lot of fiber in the diet. We get fiber in the diet through our fruits and vegetables because the fruit peels and the vegetable peels, especially when you eat in salad form, are some of the places where we get really good fiber. Another good place to get fiber is from millets. This is the International Year of Millets, and all the millets are very, very good sources of fiber. We have jowar, bajra, we have rajgira, ragi, kuttu, all are good sources of fiber. And if you incorporate more of these foods in the diet, that would increase fiber. Fiber binds with cholesterol, excess cholesterol, and removes it from the body. So that will at least prevent that further diseases from developing. They will prevent the possibility of a heart blockage. They will prevent the possibility of hypertension and reduce inflammation in the body. Fiber will also help in improving the health of the gut. Fibers help to increase the good bacteria that is present in the guts, and that good bacteria can help to reduce insulin resistance and weight loss. So we would like to increase fiber in the diet. The third thing is to get a high protein diet. Proteins are, in very simple words, because proteins are a little more difficult to digest, the body struggles to digest them and uses a little bit more energy when digesting proteins. And so that is why it can help to reduce weight. At the same time, proteins are also good to build up muscle and reduce fat mass. So the best thing for anybody with PCOS would be to have a little bit of moderate carbohydrates coming in from low GI sources. Low GI and mid GI sources will include all your fruits and vegetables. It includes all our pulses and dals and legumes. It will include like I said, it includes all the millets. All these foods are low to medium GI, which will give you the energy that you need to function through the day and yet not necessarily contribute to weight gain. And they would need high protein and a low fat diet to help them reduce the weight successfully and healthily. It's very important not to follow any kind of crash diets because it doesn't always work. In the first few weeks or in the first few months with a crash diet, you will definitely see some drastic weight loss. But once you stop that diet, that weight will increase much faster than you were able to lose it. Suppose you lost 20 kgs on a crash diet. Once you stop the diet, you will raise 30 kgs weight. And this yo-yoing of weight, pehle kam, fir zyada, fir kam, fir zyada, that is even worse than having higher weight, because the body experiences a lot of changes on an internal level when weight is increased and when weight is lost. So it's better to lose the weight very, very gradually and slowly. Give the body time to adjust that there are going to be some changes now. And so this crash diets and all, rather to be not followed whatsoever. All these dietary changes should also be complemented with some amount of physical activity to give your body some movement, because it is very important to improve health that there be some amount of physical activity. It doesn't matter if the person doesn't have time to go to the gym. If you don't have time to go to the gym, even if you have very little time, just the difference between taking the elevator and taking the stairs can be the difference that you see in your health. Next, please. So seed cycling, this is a commonly used method for hormone management, which is very, very common in the West, but it is becoming more and more commonly used in India as well. It has not been tested on a scientific level, but from case to case, there have been wonderful results in people who have done seed cycling, and it helps to manage the hormonal imbalance that is easily seen in PCOS women. The way to follow this seed cycling method is very simple. It includes 4 different seeds that you can see on your screen right now. Flax seeds, which is alsi, pumpkin seeds, sunflower seeds, and sesame seeds, that is til. We use these 4 seeds in a fixed cycle through the month, and that is what is called as seed cycling. So in day 1 to day 14, which is called as the follicular phase, that means day 1 is when period starts. And from that day, for the next 14 days, the person has to eat 1 spoon of flax seeds and 1 spoon of pumpkin seeds daily. What you can use it in any different ways you want, but you don't have to roast these seeds. They have to be eaten raw. Either if you can eat it raw, you just eat it raw, or you can powder it and mix it with other things that you eat through the day. The next 14 days, that is luteal phase, from day 15 to day 28, is when we eat sunflower seeds and sesame seeds. Again, same way, raw and ground. You can eat the seeds raw if you're comfortable. If you're not comfortable, you can use the raw seeds in any other form. You can use it in a smoothie. You can put the blended powder in a dal or whatnot, and you can use it there. And so these are the cycles that we follow. Each individual seed has its own properties which make it helpful to help the management of hormones in the body, as well as they are selected for this particular time depending upon the way the hormones rise and fall during the menstruation. For a PCOS woman who does not have regular periods and they cannot judge how to start the cycle, you can start the cycle by using the lunar cycle. You go along then with the moon. So one new moon to full moon cycle, and you start with those cycles. So the day when there is a full moon is when you start, and then you go by a 14-day break. And that is how you do seed cycling. Each of these seeds are very, very rich in fiber as well as omega-3 fatty acids, which cause a reduction in, again, insulin resistance. They cause help to reduce inflammation, and they can help to improve the hormonal balance in the body. As well as sesame seeds are also very good for calcium in the body. So these seeds have their own individual health benefits also, but they are also able to help to manage the hormonal imbalance that is seen in PCOS. Next, please. Apart from a normal healthy diet, there are certain foods that you can include, especially to improve the hormonal balance in the body and also to lose a little bit of weight. The first one is spearmint tea. You can use loose leaf tea, or there are a lot of tea sachets also which have spearmint tea. So a weak tea steeped with and had, it does have androgen effects and can reduce acne and facial hair. It's also very soothing and gentle on the stomach, so it doesn't really cause any other side effects. There will be no acidity or some such with this tea. Next, please. There are berries, any and all kinds of berries. There is strawberry, there is blueberry, there is blackberry, there is mulberries, what we call as sharetooth, goji berries, cranberries. All these berries are now available to us in India. In the West, very commonly consumed, but even for Indians now, berries come in a very short season. But whenever there is a season, please try to consume as many berries as you can. These berries are extremely rich in a functional substance which is called as anthocyanins. These anthocyanins are the reason why berries are so brightly colored. The blues and the blacks and the reds that we see are all because of anthocyanins. These anthocyanins have a very strong antioxidant effect in the body. They can reduce inflammation, and they can also have some anti-aging effects for the body as well. Next, please. Salmon. Not just salmon, but also other fatty fish are very rich in omega-3 fatty acids. Another very good source is mackerel. They can help to reduce cholesterol in the body and are good sources of selenium. Selenium is also a protective mineral because it reduces oxidative damage. All the exposure to overprocessed foods and the environmental pollutants are what causes the body to have oxidative damage. And all this oxidative damage can cause a lot of diseases. So we need to include more foods in our diet which can be antioxidant in nature. So salmon is one of them. If somebody is a vegetarian and cannot eat fish, there are also other sources of selenium. Most of the nuts, all are almonds, pistachios, walnuts, pecans, all the nuts are decent sources of selenium. One of the best sources is Brazil nuts, and you can include these nuts in your diet as a source of selenium. Next, please. Legumes, very simple, humble legumes which we have at our homes. In all of our homes, you have rajma, choli, all your dals, whether it is moong, tur, masoor, any of the dals, and all your whole pulses, chana, rajma, soybeans, choli, all these legumes are very good sources of protein, and they help in loss of weight. They also add decent amount of fiber to the diet, as well as are good sources of magnesium and zinc. Magnesium helps to keep blood pressure in control. Where there is a lot of inflammation, there might be a chance of developing hypertension. So magnesium helps to keep the blood pressure in control. And zinc is, again, very protective in nature, very much like selenium. So we want to add more of these nutrients in the diet. Next, please. Probiotics. Probiotics are those foods which help to deliver good bacteria to the gut. So we have a lot of foods which we either have at home or the things which we can buy ready-made from the store, which gives us a lot of probiotics. At the home level, we have dahi. We have our chas, which we make from the dahi. We have all the fermented things which we make at home, your idlis and dosas and all those other things. They will have probiotics. If there is a person who is buying from the store, there are even more options. There is the option of buying sauerkraut, that is a Western preparation of pickled cabbages, which has a lot of probiotics. There is kimchi. Kimchi is a Korean preparation which uses, again, there is cabbage, radish, and a lot of other things that go into the preparation of this fermented item. But it is an accompaniment to the main meal and also very rich in probiotics. You can buy probiotics as tablets from the chemist, and you can also have probiotics in other bottled forms, Greek yogurts. There is probiotic drinks also available in the market. All of those things are your options to increase probiotics in your diet. Where there is fiber and probiotics coming in from the food, the gut health will greatly improve. That can help to make a person more energetic and more regular in their constipation will not be there. It helps in management of weight and it helps in insulin resistance as well. Next, please. Tomato. Tomato is a very, very important ingredient that we should be using very much in our food. The red color of the tomato, again, comes from an antioxidant known as lycopene. Lycopene is a very, very powerful antioxidant and it does reduce inflammation greatly. All the foods which have color will have these antioxidants of different kinds, because these antioxidants are what give color to the foods naturally. The best thing about tomato and lycopene is that you don't have to eat it raw if you cannot. When the tomato is cooked, when it is exposed to heat, the lycopene becomes more easily available to the body. So if a person has eaten tomato raw in a salad versus a person who has eaten tomato soup, the person who has eaten tomato soup might get more lycopene. So it's very easy to incorporate tomato in the diet and get all these anti-inflammatory benefits. Next, please. Certain foods that definitely have to be avoided. Any fried snacks, samosa, vada pav, French fries, all these fried snacks have to be avoided. High sugar foods will include all the desserts. All the bakery products will have a lot of maida, they will have a lot of butter, and they will have a lot of sugar, all of which have to be avoided for somebody with PCOS because they need to lose that fat. Sodas and soft drinks, which means all the flavored drinks, the carbonated beverages, they will also have a lot of sugar, and that is not good for the body at all. Processed foods is the easy way to judge a processed food is that you have to go to the supermarket and buy it from a packet. That will be processed. It has been processed in a factory, put into the bag and sealed and put in the supermarket where you bought it. So it is processed, and for the most part, it will not be good for health. High sugar cereals. This is the breakfast cereals that people eat, where you buy the box and you eat the cereals. Always when you are buying the cereals, please ensure that you look at the label on the back and see if there is a lot of sugar in it. The ingredients are mentioned on the label, and if you see sugar there, if you see a lot of sugar there, that cereal has to be avoided. Alcohol and red meat, also very clearly not good for health. They cause a lot of heart problems and inflammation and other issues in the body, which cannot help to go from PCOS to healthy women. So we would like to avoid all this. For a non-vegetarian person, if you are considering a meat source to include in your diet, the recommendation would be to have the fatty fish, like I mentioned, salmon, mackerel, all those fishes. And if you want meat, then you would go for the lean meat or the white meat. So chicken is a good option, and to some extent, turkey is a good option. Still, these meats should not be consumed in a fried form. They should be cooked as a gravy or steamed and then consumed. Next, please. So at the end, just a couple of things to be kept in mind. The first thing is a high fiber, low fat diet, which has to be maintained. Regular physical activity, if there is no time for a full-fledged activity, then small things. Walking as much as possible. If the workplace is close or if the school or college is close by, rather than taking a rickshaw or a bus, they can walk to that place. If there is a staircase available, rather than taking a lift, they can take the staircase. And management of stress as much as possible. Meditation, yoga, and other extracurricular activities that make somebody happy would be a very good way of managing stress. So, a good combination of all three will help to manage their PCOS condition well. Next, please. So, we've come to the end of our presentation, and I hope that everything that I said was well received. And it's very difficult for somebody to have PCOS, but it is not the end of the line. There are solutions possible for you. So if anybody is looking to work towards better health, there I am here. And thank you so much to Kartavya for giving me this opportunity.
Thank you, Aditi, for this wonderful session.
Thank you.
In fact, the audience had been pouring it with a couple of questions, and I'm just trying to kind of club them together and see how we could just answer a couple of questions.
Yeah.
So, there are a couple of people who have been asking about whether this is a professional hazard or do we kind of get PCOS because of the profession which we are into. And some questions linked to it is it curable, remedial, or lifestyle changes? How does it impact?
So, yeah, like I said, a lot of inactivity can increase the risk of PCOS. So, in some ways, you can consider it to be a professional hazard for somebody whose work involves them sitting at a desk in front of a computer all day long, where there is no scope or no reason to get up off the desk and go out to even have a small walk. They will be spending the majority of their waking hours sitting in one place, and whatever is left will be spent in sleeping. So these are the type of professions which are just making it easy to gain weight. And once the weight is gained, then it is something that can cause PCOS. So changes in lifestyle can really benefit PCOS patients dramatically.
Okay. There's someone who's wanting to know about, because most of the topics you did cover, because I think people had been a bit. Do you think because is reversible?
The changes that happen inside the body may not be completely reversible, but it is possible to reach a place of near normal health by taking care of everything that is involved in PCOS management. It is possible to reduce androgen levels. It is possible to reduce insulin resistance. And it is possible to achieve regularity in menstrual cycle and fertility. So while the PCOS may not be completely gone, there is possibility to reach a point where it's no longer a problem.
Okay. And one question I think which gets connected to it in a similar ways, are there any supplements or these natural foods which we look at which could help to reduce mastalgia, mood swings, uh, which are associated with delay in periods? So what would be your take on it?
So the mood swings usually happen because of hormonal imbalance. So a couple of things that are very helpful in improving mood swings is going to be to get the periods back on track. So once the hormone levels come down, which usually is managed with medicines, the androgen levels are managed allopathically with medicines. So once they come down, the mood swings will usually reduce on their own. But also omega-3 fatty acids rich foods, which help to improve good cholesterol and reduce bad cholesterol and overall reduce inflammation in the body, will also factor in to improve moods. In terms of supplements, there is no reason to specifically seek supplements out. But if it is becoming difficult for somebody to include these things in their diet naturally, then you can go for the supplements. Like N3 fatty acid supplements are available. You can buy cod liver oil, it comes in tablets. So, those are the supplements which a person can use.
Okay, a pretty long session, but someone just wrote one question and I thought it was important. How long should the seed cycling be done? So,
Seed cycling can be continued for at least 1 to 2 months, or maybe even a third, as long as you don't experience changes. These type of dietary managements should be operated on a case to case basis. So there is no one formula that 3 weeks, 3 months karna hai and then chhod dena hai. You experience the changes when you start seeing regularity, then you can slowly wean yourself off from the changes and see how your body reacts once you have stopped taking all these seeds, and slowly get your body used to the normal cycle without the seeds. So at
okay.
least 2 to 3 months would be needed.
Okay. Thank you. I think it's been a pretty long session. On behalf of Kartavya Healthy On, would like to thank all the audience for being part of this session. And a big thank you to you as well for helping us to
Thank you.
conduct this webinar on PCOS from symptoms to solutions. And it had been a great time, a long hour, but it had been exciting to kind of go through this session. Thank you very much.
Thank you very much for this opportunity.